Welcome to Bizzell Health mini web series. At Bizzell Health, we use best practices across multiple disciplines. We develop innovative solutions that build healthy, secure, and sustainable communities in our nation and globally. Bizzell Health is your solution to your most complex technical assistance and training needs. We are dedicated to preparing programs in communities in the United States and abroad to address the adverse needs of behavioral health. Our subject matter experts have decades of experience providing technical assistance, clinical support, and program management in the areas of opioid use disorders, opioid treatment programs, medication-assisted treatment, maternal and child health, viral hepatitis and HIV care management, behavioral and mental health. Over the next few months, Bizzell Health will offer a mini-series designed with your programmatic needs in mind, covering a range of topics from maintaining accreditation for opioid treatment programs to combating opioid use disorders from the point of view of multiple stakeholder groups. Each segment of the series will be available on the second Wednesday of each month at www.bizzellhealth.com/media. In today's session, we will take a closer look at community engagement and opioid use disorders, highlighting ways to improve access to prevention, treatment, and recovery services. We will also discuss bias or perceptions when addressing opioid use disorders, the unmet needs of patients, and the overall benefits to communities as a result of having access to opioid treatment programs, medication-assisted treatment, and recovery services. By listening to this mini-series, you will be equipped with best practices to ensure your programs are strategic, compliant, and culturally relevant to the needs of your local community. You'll be empowered with knowledge to strengthen your program and address issues head-on, ensuring a greater impact. Did you know that it is estimated that there are nearly 27 million people suffering from opioid use disorder? 90% of Americans struggling with addiction are not currently accessing treatments. So it is imperative to make sure that the provision of treatment is accessible to all. The U.S. Department of Health and Human Services has identified 5 specific target strategies for combating this public health emergency known as the opioid epidemic. These 5 strategies include access to better prevention, treatment, and recovery services, better data on the epidemic, better pain management, better targeting of overdose reversing drugs, and better research on pain and addiction, community engagement and improving access to prevention, treatment, and recovery services. There is a direct link between community engagement and improved access to opioid use disorder recovery services. Often, communities are just not equipped to understand, address, and foster the public for prevention, treatment, and recovery. How we engage the community can strengthen access to better prevention and recovery services. Community engagement is a process whereby a service system proactively seeks out community values, concerns, and aspirations. Incorporating those values, concerns, and aspirations into the decision-making process leads to improved programming and better results that are aligned with the desires of community members. And establishing an ongoing partnership with the community is essential to ensuring the community's values continue to shape services and the service system for greater impact. The bias or perceptions, the unmet needs, and the enhancement of community as a result of access to prevention, treatment, and recovery services. In looking at bias, we focus on the perceptions that substance abuse is self-inflicted and is not really a disease. This perception regarding the use of medication conflicts with abstinence-based treatment programs like 12-step. There's even a perception that abstinence is more effective than medication-assisted treatment and that medication-assisted treatment is not treating the underlying cause of the addiction. There are negative perceptions about methadone clinics which cause some patients to limit the amount of time they spend there. There are misconceptions that people on medication-assisted treatment are not actually involved in recovery or experiencing abstinence. What about the perception that providers of medication-assisted treatment are substituting one drug for another, which is basically like fighting fire with fire? and the perception that opioid use is not in the scope of the facility and that it should be treated by a specialty addiction provider. The unmet needs. Effective and accessible treatment for substance use disorders and mental health issues is necessary to respond to public health crises. Unfortunately, many people do not receive or access treatment. According to a 2016 survey conducted by State Line, the research and analyst arm of the Pew Charitable Trusts, 20.2 million people have substance use disorders in the United States. 2 million have substance use disorders involving prescription pain relievers, and 591,000 have substance use disorders involving heroin. Of those, approximately 10 to 40% of individuals with addiction actually receive treatment, and only a fraction of those receiving treatment actually receive medication-assisted treatment. Only 10% of the people who need to be on medication-assisted treatment for opioid use disorders are actually receiving it. More than 2/3 of U.S. clinics and treatment centers still do not have or provide medication-assisted treatment, so there is a huge gap that needs to be filled. The enhancement of community as a result of recovery services. Often, communities have limited awareness of the tremendous impact that addiction has on the community. Most communities recognize SAMHSA's recommendations for support and recovery, those being healthy and sustainable communities, stable housing, gainful employment, and purpose. Recovery programs that take into consideration this holistic approach are better equipped to provide individuals with access to these essential life elements, thus their overall quality of life is enhanced. Persistent intentional abstinence from intoxication provides those individuals with support in the engagement of daily life, gaining employment, the reestablishment of family and community ties, just being present in everyday life, and being able to weather the challenges, those daily highs and lows of life, without using substances as an external coping skill. 3 areas to consider as you are making your business case to strengthen access to prevention, treatment, and recovery services. Now that you have considered the bias or perceptions, the unmet needs, and enhancement of community as a result of access to prevention, treatment, and recovery services, it is essential that you have the necessary tools needed to engage your community and make your business case. What's a business case? A business case is a written or verbal value proposition that is intended to educate decision makers and convince them to take a specific stance. The purpose of the business case is to outline the rationale for undertaking action or a specific project. It is also used to define the parameters and management factors involved in the project itself. It provides the project manager with a tool, a guide to design, manage, and evaluate the project. How can you help build healthy, secure, and sustainable communities? We recognize your desire to provide evidence-based best practices for the populations you directly serve. Bizzell Health has an 8-hour training that will provide you with the necessary support to engage your community with the tools that are needed to identify and make the business case for your community engagement in the treatment of opioid use disorders, review an effective model of community engagement, conduct an assessment of the readiness of the opioid treatment programs and communities to implement community engagement programs, develop a community engagement plan for medication-assisted treatment programs at the individual, social, and systems levels, including identifying the most appropriate stakeholders. Determine how to address community engagement challenges and barriers experienced by opioid treatment programs. Implement, evaluate, and sustain a community engagement initiative. Engage with us at bizzellhealth.com or contact Sharon Dow at 301-459-0100 at extension 127. We will see you next month as we discuss obtaining and maintaining opioid treatment program accreditation. At Bizzell Health, we look forward to supporting all your community engagement, technical assistance, and training needs.